explain.
Here today to discuss the Not One More campaign and to stress the importance of not drinking and driving during the holiday is Dr. Jonathan Gates, a trauma surgeon at Hartford Hospital. Dr. Gates, welcome.
Well, thank you very much for having me.
Great to have you. Such an important topic. Tell us more about the Not One More campaign. What is this all about?
So in short, it's really an effort that people will say no more to one more. And that means no more drinks, to stress the importance of not drinking and driving during this holiday season, which is upon us very shortly. You know, Hartford Hospital has been awarded a significant grant from the Connecticut State Department of Transportation. And the idea is to direct a statewide campaign that addresses what I consider a pandemic of impaired driving in this state. And we've collaborated with a media group to assist in getting that word out through a media-based campaign to really reduce the alcohol-related fatalities on our roads.
Okay, let's get the word out. So as Thanksgiving kicks off this holiday season, how important is it to discuss impaired driving?
It's incredibly important. You know, hopefully we are on the tail end of this COVID-19 pandemic. And I'm sure everyone really anxiously awaits that opportunity to get together with loved ones over the holiday season and seasons as we get into this time of year. This is the biggest travel time of the year around Thanksgiving, both before and after the holiday, when people hit the roads across the states. And I really don't remember ever hearing this concept growing up, but apparently Thanksgiving Eve is also known as Blackout Wednesday, which almost encourages heavy drinking on the day before Thanksgiving. People are home from colleges and home and visiting family. And our fear is that really heading into this period of time, it almost makes for a perfect storm, with people anxious to get out, see friends, celebrate, and perhaps consume excessive amounts of alcohol in the process. I'm hearing about bad weather around this period of time, too. We always worry about that. And really, when factor in a busy travel holiday, more cars on the road, and the real possibility of an uptick of alcohol-related injuries.
All right, Doctor, being on the front line in the emergency department, what is the emotional impact of seeing impaired drivers or their victims?
It's really devastating to everyone involved. There are no winners, whether they're patients, families, or caregivers. You know, we as caregivers, without a doubt, are privileged to care for anyone who comes through our doors. I really thank God that we have teams of caregivers across the state who act selflessly to care for anyone in need. We're also part of families. We have, and friends, and it really is sort of devastating for us to see people who are involved in these crashes, knowing full well that these crashes are preventable. It's so sad to see an otherwise previously healthy person who has their life ahead of them, who are absolutely destroyed by a poor decision in drinking and driving.
All right, and finally, as a trauma surgeon, what is your advice for people as they celebrate the holiday today?
Well, everyone, you know, it's important to point out that we're not against having a good time. Everyone deserves that, especially in light of what it's been like for the past year and a half, the social disruption from COVID. We really want people to be prepared when they go out. Be prepared to have a designated driver. Arrange for an alternate ride home, an alternate place to stay to sober up before even thinking about getting behind the wheel of a car or operating that motorcycle. The big ask we have is really watch out for each other. This is what we did to counteract that COVID-19 pandemic. You think about it, the ask was, you know, hand washing, social distancing, mask wearing, and thank God we also have the opportunity for vaccinations, which have been able to control this pandemic. Nowadays, with intoxicated and impaired driving, if you see someone who's impaired, there's no way you should allow them to climb behind that wheel. It's just not worth the risk to that individual, that person's family, and to the unknown people they might harm on the roads when under the influence of alcohol.
All right, Dr. Jonathan Gates, trauma surgeon with Hartford Hospital, thank you.
Thank you very much.